Do you want to be able to perform a brow lift that is as efficient as possible but still very safe? Then you should listen to this. My name is Rebecca Gardell. I'm a medical doctor and specialized in aesthetic medicine. If you want to do a brow lift, you want to relax the auricularis oculi laterally to be able to lift the brow. However, if you want it to be very efficient, you want to go a little bit more medial. But there we have the levator. So if you get too close to the levator, you will have a litosis. And then on the other hand, if you go too high up and too close to the brow, you might get affection of the frontalis, which will counteract the lift, and the brow is not going to go up. What I usually do when I inject, I put a finger on the orbital rim and I push up the area, and then I put another finger from above, securing the frontalis, which means that Botox is not going to diffuse either in the frontalis or into the levator. I manually secure the area to make sure that the injection is going to stay exactly where I inject. The other thing that I do is I always inject very slow, because if you inject slowly, then the fluid that you inject is going to stay where you injected it. But if you inject fast, it's going to diffuse into a bigger area. And then the last thing is always inject very superficially.